Good morning, Kimball. Thanks so much for joining us today to talk about AIDS Legal Counsel and our founder, James Monroe Smith. You served as the first president of the AIDS Legal Counsel's Board of Directors from 1988 to 1991. You've been a wonderful supporter of legal counsel from then until now. Your support has allowed us to continue serving communities in need, and that's so important. We're just emerging, fingers crossed, from a disastrous pandemic that has impacted low-income communities and persons and people facing significant medical challenges. It's also become part of the political landscape, with public health issues morphing into political issues, and too often the lowest common denominator has prevailed. We confronted many of these issues in the 1980s and the 1990s with AIDS. In fact, AIDS Legal Counsel Chicago was born to address the issues that were raised in that public health crisis. I wanted to take this chance to ask you a little bit about the start of legal counsel and about our founder, James Monroe Smith. How did you get involved with legal counsel and with James?
Tom, thanks for this opportunity, and it's been a privilege over the years to work with you and the predecessor agency, the AIDS Legal Counsel. Great organizations. In any event, in the late 80s and 1990s, I was representing Abbott Laboratories in transfusion-associated HIV cases. I'm a trial partner at Winston Strawn, and one of my clients was Abbott Laboratories, which had basically developed and launched the first HIV antibody screening test. And it was really a great scientific breakthrough, but like all screening tests, it had an incidence of false negatives. And so some people received transfusion blood and that it tested negative, but it was in fact positive. And they hired lawyers and they sued the doctors, the hospital, Red Cross, and Abbott Laboratories. And so I got involved in that transfusion-associated HIV litigation, and tried a couple cases to verdict. And so James Monroe Smith was reading the news coverage about this, and he called me up. He knew that from the news coverage that I knew something about transfusion-associated HIV. And he also knew that I had been active for many years in the public interest community here in Chicago. And he said he was starting, or had started, I think, in his one-room apartment, a one-man legal clinic dedicated to representing clients affected by HIV. And so that's how I first came to meet James.
How did James want you to get involved?
Well, James said he wanted a board of directors, office space, volunteer lawyers, funding, and he asked if I could help with these needs. And so we did. We recruited a board of directors from law firms and from the community, religious community, social service community, law firms. And we recruited volunteer lawyers to help handle the cases. And once we formed the board, James asked me to be the founding president, and I think I served in that role for at least a couple of years. We found office space in the Loop. It was pretty awful office space, but that's where we started, and it was certainly better than James seeing clients in his one-room apartment on the north side of Chicago. And we also raised some money. My wife Karen and I contributed. Winston Strawn contributed. Jenner and Block contributed, and then other law firms followed. And this was in an era when, at least at my firm, Winston Strawn, we were more accustomed to donating to the Lyric Opera and the museum than anything that had the word AIDS in it. But my partners agreed, and we contributed to the founding of the AIDS Legal Counsel, and other law firms did as well. They followed.
And what are your memories of James and his commitment to the work of the AIDS Legal Counsel?
I remember him as a really, really brilliant lawyer. I mean, he knew everything there was to know about this kind of litigation and counseling. And he was HIV positive, so he was very focused on helping others who were similarly situated. And my memory of James is that he was tireless. He had a very big wish list, and he made it happen. It was his passion. It was his life, and I also think I remember, although he didn't talk about it too much, I think he was afraid of losing his life, and he ultimately died of his HIV infection. But I remember him as just a tireless community organizer and a really, really good lawyer.
Any insights about what we learned during the AIDS crisis and AIDS Legal Counsel's early work that resonate today?
We certainly learned during the AIDS crisis that the rapid deployment of really excellent lawyers saves lives, particularly for those clients that were HIV positive. Time was really of the essence. Remember, sadly, that the wheels of justice at the time did not move quick enough for some of our clients who became too sick and passed away before we could obtain legal relief. But for others, the AIDS Legal Counsel changed their lives. And I think the same is true today for the Legal Counsel of Health Justice. It's staffed with excellent lawyers who are making a huge difference in the lives of their clients. And once again, we've seen that the rapid deployment of highly talented lawyers to handle an emerging health crisis such as the COVID-19 pandemic can really save the day. And that's why we all need to continue supporting the work of the Legal Counsel for Health Justice.
Thanks so much. Thanks for sharing that with us. Again, we're so grateful for your longstanding support. And I also have to mention just your longstanding support for legal services throughout Chicago and Illinois. Truly, Karen and you have made a huge difference for so many people in Illinois. And we're so grateful for it here at Legal Counsel for Health Justice and for the just countless number of other organizations that you have helped. So thanks, and thanks for sitting down and talking to us today about the start of AIDS Legal Counsel and James Monroe Smith.
Yeah, it's my pleasure. Thank you very much for the opportunity.